Well, hey everyone, and welcome back to my channel. My name is Jessica Leichtweisz. I'm the CEO of Hope Education Services. A parent sent a question in saying, what's the difference between ADD, ADHD, and autism? And honestly, I'm a clinician and an educator, so I didn't necessarily know the answers. I know ADD is not still a common term today, but I have a friend who's a developmental pediatrician. She was so generous to come on and to get this question answered. There was nobody more qualified than Dr. Robles to answer this question. Thank you so much for coming on and for answering this question for parents, and really what's the difference between all these diagnoses, and when do they go hand in hand, and do they always go hand in hand?
Hello, you're very welcome. Happy to chat with you today. So that is a very common question, and there's a lot of ambiguity there and a lot of overlap. So first off, I can help by kind of describing what ADHD or ADD was. So back in the day, it was called ADD, but now, several years ago, they did change all those diagnoses. So they are all under the umbrella of ADHD. But there are three types. So the inattentive type, which used to be called ADD, hyperactive, impulsive type, and then combined, where you have a combination of those two things. So I just wanted to clarify that. And then with autism, you also have your core definition of what you need to have in order to meet criteria. So I think it helps to kind of know what qualifies for that diagnosis. So the first thing is you're going to have challenges with social communication skills. So sometimes that can range anywhere between the child not showing the social interest all the way up to showing interest, but not really quite knowing how to initiate interactions or relationships or to make those. A second big thing is repetitive or restrictive, rigid behaviors. So those could be movements, those could be things that they feel they have to keep doing over and over again, and just being really particular or rigid about a routine or order, placement of things, at which can lead to meltdowns. So I think that kind of helps in understanding what each of those things can be. Now, you don't always have to have both of those things, but it is pretty common to have both. I think it's about 50% of kids can have both of those two different diagnoses. The difference is when a child has just ADHD, sure, they can look like they have maybe autism if they're inattentive, especially because they're not maybe going to respond to their name as well. They might hyper fixate or focus on certain things, and it's hard to get their attention in that moment. But what's different is they should still have the same social skills as any other child would generally, where they should still engage, interact, make friends pretty easily. Sometimes there's conflict because of their behaviors, but they should still have that social engagement and pretty solid play skills as well, where they have good pretend and imaginative play. They play back and forth well with peers as well. Whereas children that have autism generally do struggle with those things. So a child can have both autism and ADHD because they have all of those characteristics of autism, but then they also are showing those symptoms of ADHD where it's hard for them to use their executive functioning in order to pay attention for a sustained, prolonged amount of time, to direct their attention to things that they don't really enjoy as much. They might be extra hyperactive for their age, and it has to be in more than one setting, usually at home and at school, that the teachers also say, we're really having a hard time with your child sitting and participating or, sitting for long periods. So it's a lot of overlap, like I said, but they are two totally different diagnoses that can go hand in hand a lot of the time.
Yeah, thank you so much for clarifying that. That has been so helpful. And I know that the parents watching this are really going to benefit it. So I really appreciate you, Dr. Robles. I know that you are swamped. There's always waiting lists for months as a developmental pediatrician. And at the time we're recording this, it's noon, I believe, on the Saturday where you are located. So it's so generous of you to give up your time. I really appreciate you. If you are a parent and you have a question, I'd love to help you get answers. So head over to my website, getautismanswers.com. That's the YouTube channel. You can drop a comment right on this video and I will get your question answered.